Real quick, Doug's going to be the host. So for the participants, if you can just keep typing your questions into the chat. We may not get to them during the actual presentation itself, but once we wrap up and he passes it back to me, I'll make sure they get read in before we move to the raising hand questions. So appreciate you guys being patient with this. And Renee, I'll turn it over to you now to introduce Doug.
Great. Thanks, Doug, for being here. Doug Koebernick is the Inspector General for Corrections for the state of Nebraska. So he is going to talk to you about the correction system and some of the challenges that he's been grappling with and that the legislature has been grappling with as well, and will continue to do so next session. So Doug, thank you.
All right, thank you. Thank you for inviting me. I think this is the third time I've done this. So I had my PowerPoint from a couple years ago put together and I'd kind of cleaned it up. And then yesterday I was mowing my lawn and I decided I needed to redo the entire thing. So hopefully it makes sense. I was up last night because I should not mow. I think that's the lesson here. So my name is Doug Koebernick. I work as the Inspector General of Corrections for the Nebraska Legislature. And I want to give you a quick background about the position and how it was created, and then I'll go into the challenges that are facing the Department of Corrections and our state corrections system. So there's my contact information on the front. I think we'll be sending those out to you. But in 2014, the legislature created a special committee to look at corrections issues, and it really started out with the issue of Nico Jenkins, who had gotten out of prison and then murdered 4 people after saying that he was going to do exactly that. So the legislature created this special committee to dig into that issue to find out what happened, how it happened, things like that. And the senators that were part of that committee are on this page here. Senator Lathrop was the chair. Senator Seiler from Hastings was the vice chair. And as that committee moved along, they started finding out that there were more and more problems going on with the Department of Corrections. And ultimately, after a very intense period of hearings and looking through information and doing a lot of digging and everything, they came up with a report to the legislature and had a lot of recommendations. One of those was to create the Office of Inspector General of Corrections. A few years before that, they had created something similar for the child welfare system, and they decided maybe it was time to create a position like that for corrections. So they knew what was going on. So they had their some sort of set of eyes watching the correction system so that they were more informed about what was going on. So I was fortunate enough to staff that committee with a couple other staff members. And I have a history of working in the legislature for quite a while, not as long as Tom, but I'm up there a little bit. And in 2015, the legislature actually passed the law to create this position. And at the time, I really wasn't interested in pursuing it. And I had some people talk to me, and I ended up applying for it and was able to get the job. I was appointed to a 5-year term in the fall of 2015, and this kind of just lays out real quick a few facts about the Inspector General position. It's really a position to provide some level of oversight, like I said, for the legislature, for the public, as far as the Department of Corrections and the parole system as well. I'm given a lot of responsibilities as far as doing investigations on serious incidents, deaths, injuries, when there's riots or mini riots or anything going on, or even COVID-19. Those are all things that I need to be looking at all the time. Every September, I put out an annual report that kind of documents everything that's gone on in the corrections area in the last year. Has a lot of data, a lot of statistics, a lot of information there for the public and for the legislature and anybody else really. And those are found on our legislative website. I provide information and testimony to the legislature on a regular basis. And I'm certified by the Association of Inspectors General. That is one of the requirements in the law. And I also I added this part, I'm also the smallest Inspector General office in the country. It's just me. Our Child Welfare Inspector General has 3 people that work for her. I'll go right into it. There's 3 primary challenges as I see it in the correction system. These have all emerged over the last several years, and there's more to it than that. And there's also positive positive things that are going on in the correction system, but my job really is to look at what needs to change, what needs to be improved, things like that. So I'm going to focus on these three primary challenges. In the past, it was really the first two, but I decided that there's a third one too. So it's overcrowding. Our system's very overcrowded, and I'll go into each one of these in more detail. Staffing challenges, and then facility challenges. So when you look at overcrowding, over the last few years, Nebraska grew to become the second most overcrowded state correctional system in the country. Only Alabama had a higher overcrowding percentage than Nebraska. Our overcrowding is measured by the level of the design capacity of a system, and that system has become overcrowded due to increased population, along with higher incarceration rates, and we've had very minimal changes in the capacity of the system. So as our population has grown and our ability to hold them, or the number of beds that we have designed to hold them, has stayed flat for the most part, of course we're going to become more overcrowded, and that's what's happened. This chart here is one that I've whipped up in the past and used in my annual report. It just shows you the growth over the last 7-8 years as far as inmates that are within the Department of Corrections. You can see there it was about 4,600 people in 2012. In 2019, it had gone to about 5,600. By the end of 2019, it actually, and I'll be updating this chart from the next report, it had gone to about 5,700. So you're talking about 1,100 inmates over that time period that had gone up. So that kept going up. You can see the trend line there, that dotted line. It just kept climbing and climbing, and the latest projections show that it would continue to climb as well. I do want to make a little note there on the bottom that while it did peak at 5,700 inmates, it has dropped down to about 5,500 or so in the last couple months, and that's primarily due to a decrease in admissions since the COVID-19 crisis began in March. County jails and the county justice systems are not sending people to the state, and so the state system has benefited from that. The question that I have and many others have is, when this gets all done, what is there going to be like a backlog, and all of a sudden all these cases get pushed through and we get a big influx? But in the meantime, we are down a little bit, so that makes our system a little bit easier to handle. The primary prison, as far as who benefited from this decrease, is the Diagnostic and Evaluation Center in Lincoln. And that is the center where men who come into the system are diagnosed and assessed and figured out what they need as far as their future in the correction system, what kind of programming, what kind of custody level, things like that. And so they come into that facility, and then they go from there to the other prisons in the state. That facility was running at about 500 to 540 people in it. It's designed to hold 160. So it was running at over 3 times its capacity. You had people sleeping on these cots on the floor, things like that. But because of the decrease in admissions, we've gone from over 500 people to about 350. So that has really benefited from this COVID crisis. So there is a positive in some way, I guess. When you look at our design capacity, and that's the measurement as far as the overcrowding, design capacity is determined by how many inmates are actually in a facility compared to the actual number that the facility was designed to hold. So just a simple example is that if you have a prison that was designed to hold 1,000 inmates and it holds 1,000 inmates, then it's operating at 100% of its design capacity. If we have 2,000 inmates in that prison, then we're operating at 200% of its design capacity. Nebraska has been operating between 150 to 163, 64% over the last several years of its design capacity, which, like I said before, it makes us the second most overcrowded system in the country. What happens then is you really have, well, we can talk about just one quick example is the Community Corrections Center in Omaha. It was designed to hold 90 people. It usually holds 180. And what happened is that each cell now, or each room, holds double the number of people that it was designed to hold. So you have that level of overcrowding. But the thing is, none of the other parts of that prison increased as far as like where they would eat, where they'd have programs, things like that, bathrooms and everything. And that's across the whole system. So that's why that overcrowding measurement is important. And then that leads into this. In 2002, the Nebraska legislature passed the Nebraska Overcrowding Emergency Act, because at that point in time, we could see that prison growth was going up. And they decided that if the system was over 140% of design capacity, then that would result in an emergency needing to be declared, and then steps needed to be taken so that it didn't grow beyond that. Well, one of the problems was that legislation said the governor may declare an overcrowding emergency. So since 2002, no governor has actually declared that an emergency. The legislature in 2015 changed that so that starting this July 1st, if the system is over 140% of design capacity on that day, then the governor has to declare an overcrowding emergency. And the whole point behind that is that 140% was thought to be a better operating level than 150 or 160%. And then the law says that the inmates would be released until it gets down to 125% of design capacity, which then would end the emergency. We're currently over 550 inmates above 140% and about 1,100 inmates above 125%. I get asked a lot, primarily by people that live in the prisons, okay, does that mean I'm going to get out on July 1st? Am I free to go? Am I going to be one of those people that are released because we're so overcrowded? And the answer is no. All the law says is that the governor shall declare an overcrowding emergency. But it doesn't say that anything really has to happen other than that the parole board has to look at people who are parole eligible and decide whether or not they want to move them out. All those people who are eligible already for parole have had parole hearings. The parole board has taken looks at them in the past. So it's not like they haven't looked at them and decided like that they need to stay. That there's some reason that they're staying. They might say, okay, there's a few here that we might want to move out, but there's only about 850 people that are currently past their parole eligibility date. So our pool is really small, actually. So you're going to hear a lot about this in the news over as we lead into July 1st and the declaring of the overcrowding emergency. It's my belief that nothing really will happen on that date, and our system will continue to be overcrowded. People always wonder, why did our population go up? Why has it gone up so much? And this is a chart that I pulled out. It's a little dated. They don't have the updated numbers yet, but it shows the incarceration rates for jails and prisons in Nebraska. And you can see going back into the 70s, that has increased significantly. The one thing that this doesn't show is that we actually compare very similarly to other states and to the country. This is something that's gone on over the last 30 years with all systems, all correctional systems. So as our incarceration rate has increased, and that means the number of people put in jail for 100,000 people in our country or in our state. As that has gone up, then that's going to, of course, drive how many people go into your prison system. There are a lot of attempts throughout the country to lower that incarceration rate through sentencing reform and other initiatives, and Nebraska's tried that to some extent, but hasn't been very successful. But there are continuing attempts to do that. I'll jump into number 2, that's staffing challenges. For a number of years, Nebraska's correctional system has had a number of significant staffing challenges. Our turnover rates of frontline staff have been over 30%. Overtime has increased significantly for those staff. Vacancies have hit all-time highs. Staffing challenges are rampant throughout the system, but primarily at Tecumseh State Correctional Institution and the Nebraska State Penitentiary. Those are our 2 maximum custody facilities that have the most problems as far as staff. And recruiting, as my annual reports have shown, has not been really that big of a problem. We've seen an increase in the number of people that come into the system to work, but we can't retain people. So that's been very difficult. There's been a lot of attempts lately, and you've probably seen these on the news or on a billboard or on the radio, heard on the radio, different bonuses that have been attempted. Right now, some staff, the corporals at some facilities, are getting $10,000 signing bonuses that are spread out over 3 years. that's been 1/10. So we've had the bonuses. There's been some staff salary increases. Like I said, there was some resistance to that over the last few years, but finally action was taken to increase those frontline salaries. Those would be like the corporals, the caseworkers, the sergeants, those folks. And as a result, and combined lately with the downturn in the economy, there has been a change in staffing levels. So we're seeing an uptick in staffing levels, which is definitely a positive, and it's definitely needed. What happens when you have staffing shortages is that the facilities are less safe. People do not get the program they need. They can't move around. They can't get through the system because the paperwork's not being done as far as their classification levels. What all sorts of things happen along the way. Safety is really important because if you don't have enough staff to do appropriate cell checks, you're not finding weapons, you're not finding drugs, you're not finding other contraband. And so it just kind of adds up, and you end up having significant problems throughout the system. I thought I'd throw a few charts in here to show you just, I think these paint a really good picture. If you look at the overtime for facilities, for those frontline workers going back to 2014, it has gone up and up and up, and it continues to go up. I think we're going to see a leveling out with the next data that I get from the spring, hopefully, because of the additional staff coming into the system. But even then, if it flattens out, we're still at all-time highs. If you look in the 2015 time period of this chart, there's a big spike. That was when the first riot took place at Tecumseh. So a lot of facilities had their staff going to Tecumseh to assist with that. And that created a significant jump in overtime. Then that kind of came back down. But so we peaked there back then, but we continue to climb. I think that chart shows a lot. The next one would be overtime expenditures. As a result of all that overtime, that comes at a cost. And you can see there that it went from, $5 million, $4 million, but 10 years ago or so, and now we're up to $15 million. So there's a significant dollar cost to it as well. There's also a personal cost too, because the staff who I talk to on a regular basis, they're putting in 60, 70, 80 hours a week in these facilities. Those are very high stress positions. There's a lot of safety issues. There's just a lot going on. It's not a job where you can go sit down and relax for a couple hours and just work on some paperwork or something. You're on your feet, you're on guard all the time. You get stressed out, and it creates a lot of personal issues. I've had a lot of conversations with staff throughout our facilities that were very troubling of what they're going through in their personal lives and their emotional state, things like that. So in addition to this fiscal cost that you see, there is also a personal cost. Their turnover rates, going back 10 years, we were about 18 to 20%, which is still high. Director Frakes from the department has indicated that 15% is a healthy turnover rate. And that continued to climb and climb and climb and got into the low 30s. And now it's settling down a little bit. I hope it keeps dropping, but we have to remember that it used to be much better, and I'm hoping that we can get back to that. We will continue to watch that. And then this one just shows you the positions turned over during a year. So you go from 230, 250 positions 10 years ago getting turned over, and these are for those frontline workers again, to over 400 people positions being turned over. So it just gives you a better idea of what I'm talking about. My annual reports are full of lots of data like that, and if you want to look that up, I have a link to that at the end of the report. The third thing I want to talk about are facility challenges. Prior to 2016, the last prison that was built in Nebraska was the Tecumseh prison, like I said, in the year 2000. Since that time, the population has continued to increase. Most of the facilities are aging. The Nebraska State Penitentiary was originally built back in like the 1860s, and of course it's had modifications along the way, but it is a very old prison. Even the buildings that people live in are 30, 40 years old, and they get a lot of stress and a lot of wear and tear on them. For example, there's 2 units in the back side of the state penitentiary that hold minimum custody inmates, and they were supposed to be temporary housing facilities that were going to hold 100, and they've been holding 200. So you have all these people piled on top of each other in bunk beds. You have kind of a day room area where they can gather, but that was designed for way less than than the number of people that are in there. The bathrooms were designed for half the number of people. Things like that are what I talk about with overcrowding of prisons and everything. But when you have facilities like that that are aging and that are being used in a way that they weren't designed, that impacts so many things, including how people receive programs, how many get their rehabilitation needs met, all safety issues, things like that. So I wanted to share that as well. So we have all these facility challenges. The Nebraska State Penitentiary, if we really want to do it right, we would have to spend millions and millions of dollars to get new housing units and everything. One thing I wanted to add too is that when you look at these housing units, they're typically built just to store people and not to rehabilitate them. And that creates problems as well. We know a lot more about what we need to do to make people successful and have them transition back in the community in a better way than we did 30, 40, 50 years ago. I want to give you an idea, though, of some of the things the legislature has done in the last few years to assist with overcrowding and with those facilities. A 100-bed male dormitory that cost $1.8 million was built at the Community Corrections Center in Lincoln. So that added some capacity for men. The men who stay there are ones who are on work release, so they're actually working in the community. So this is their last step before they transition back into the community. And then the legislature also provided the department with about $20 million to build a 160-bed community corrections unit in Lincoln. It's right next to the current facility. It's very nice. It has it's kind of state-of-the-art place with a lot of programming space, classroom space, a new cafeteria for the entire facility and dining area. That was pretty significant as far as the cost. The one problem with that is that we actually don't have 160 women who are qualified for that level of custody. So it's not completely full. The construction is currently taking place on a 100-bed dormitory facility at the Nebraska State Penitentiary for minimum custody inmates. That's at a cost of around $5 to $6 million. And that is actually savings from the women's unit that at the Community Corrections Center, because that was estimated to run at about $26 million. It came in low, so the department asked the legislature to reappropriate those funds for this 100-bed minimum custody facility or dormitory, so that could relieve some of the pressure on those other minimum custody units that I talked about earlier. Last year, the legislature began to fund a 384-bed high security bed unit. These are for very high custody men at the Lincoln Lincoln Corrections Center. And that's at a cost of about $49 million. And then there's also a project that's been underway for a few years that merges the Lincoln Correctional Center and the Diagnostic and Evaluation Center. They're right next to each other, and this kind of will combine the two. And it costs $75 million. They'll have a new medical unit in there. They'll have a new mental health unit. They'll have new dining, cafeteria, visiting, office space, things like that. But that's at a significant cost as well. So that actually, right now, the largest prison in the system is the Nebraska State Penitentiary. It holds usually around 1,350 inmates. When these two prisons are combined and then you add those 384 high security beds, that prison will be about on the same lines as the Nebraska State Penitentiary, probably holding 1,300 to 1,500 inmates, depending on how it's operated. But despite all these projects, the system is still facing a high level of overcrowding while that inmate population is projected to climb. So even though we're adding these beds and the number of beds are going up like this, the projections continue to go up. So we don't even know if we're keeping pace with what we need to do. I'll just mention a few additional issues before I open it up for questions. When Tom was talking about the budget, the Department of Corrections budget is over $230 million. And then if you look at other justice-related budgets, like with the court system, parole, probation, we're spending a significant amount of the state's budget on justice issues. Restrictive housing challenges, that's when inmates that get into some trouble are put into a unit in which they are basically housed in their cell for 23 hours a day, they get out very little. We've had more and more people staying for longer periods of time in that system, in that type of system. That creates a lot of challenges and a lot of stress on the inmates and on the staff as well. One of the benefits of COVID is that that number has gone down significantly because they've tried to free up some beds to use for quarantine areas and things like that, and just have moved a lot of people out. So we've actually seen a significant reduction in the number of people in the last month or so in restrictive housing settings. We have a lot of contraband concerns. There's a lot of drugs that get in. K2 is the most popular one, but other drugs come in as well. Also weapons and cell phones. Those things come into like the Nebraska State Penitentiary and Tecumseh at pretty high rates, especially the state penitentiary. Staff safety concerns. I monitor a lot of staff assaults, staff that get injured on the job. Do a lot of investigations into those things, and those continue and have increased, in my opinion. One of the things that I always try to challenge people is what should be our population goal for our correction system. Right now, we're operating, like I said, at about 154, 55% of our design capacity. What's the goal? Should we be operating at 140%, 125%? Should we be operating at 100% of our design capacity? Right now, like I said, we're number 2 in the country as far as overcrowding, but if we went to 125%, we'd still be one of the 10 most overcrowded systems, just to give you some perspective. We have suicides that take place in the correction system. That's an ongoing concern. Programming needs for incarcerated individuals, whether that's mental health programming, job training, education, things like that. There's definitely a need for that, because the more that we can do for people to help them inside, they're going to be more successful on the outside, because most of the people will be coming back out to the outside. And that kind of leads to the next step, which is transitional and post-release needs of incarcerated individuals. When people come out, they also need assistance. A lot of them do, as far as housing, employment, education, just life skills. We have a lot of people that are coming out after being in for long periods of time, and that's quite a hard transition to make. And so there's a lot of needs there. We do put a little bit of funding into that. A few years ago, Senator Ashford created a reentry grant program that's been, I think, very successful. And so that has been a real win for the department and for parole and probation and for the state. And so we need to probably look at doing more of that. The transparency of the system is always a challenge. And then COVID-19 has presented an array of problems and challenges over the last couple months. And I'll be doing a report on that at some point as well. And I kind of flew through that, but that gives you kind of a real quick overview of corrections issue. Unlike Tom, he has to cover the entire state budget. I just had to cover one area. So if you have any questions, I can help you out with that.
All right, Doug, if you could scroll over my name real quick and
Make host?
yeah, make me the host. Yep.
Okay.
All right, thank you. And I'm gonna stop sharing your screen so that we can all see each other again. And let's see if we have any questions. I see no questions in the chat at the moment, so I think we are open to, so if you want to ask a question of Doug, just raise your hand. And
we'll let Lisa go, and then.
There's just so much, but so like, what is the biggest stumbling block to be able to provide that programming? Is it just not having the space capacity? Is that the primary problem?
I would say the space is a huge challenge. When you look at programming, there's different types of programming. If job training, job skills, things like that, there just isn't the space out there in those facilities for that. Education, there's some classrooms in some of the facilities, but like at Lincoln Correctional Center has 500-600 inmates, and there's I think 2 small classrooms. So yeah, space is a significant challenge. And part of that, like I said, was these places were built back in the day when it was just kind of house them and store them and then kick them out and not do a whole lot with them while they're there. And that just leads to people coming back into the system.
So is there any, does anybody have like out of the box ideas, like how could you provide more spacing that you hopefully would only need in an interim period, so you got that population down, and then could create more space within the facilities already that you have? I mean, is there any way to do that, or any talk about that?
You know, at the Community Correction Center in Omaha, they're bringing in like a modular classroom.
Mm-hmm.
That's been something that's been talked about in the past. So doing some things like that, I think, can help out. A lot of times it's just the overall footprint of the facility is they've grown so much that they don't have a lot of space for that, but there are options like that. Or even providing programming on weekends and nights, doing things like that to kind of, instead of doing that 8 to 5 Monday through Friday thing, there's ways to provide outside those normal hours, I think, that they can get very creative on. One of the good things about that reentry grant program that I briefly mentioned is that they are bringing people who are the grant recipients, the different programs in the community. Some of those folks are coming inside and doing more, but Metro Community College has been huge. They've been coming into most of the facilities and providing lots of job skills training, education, things like that. They have, like a commercial driver's license virtual machine, so you can get your CDL almost. They have a virtual welding operation at the Omaha Correctional Center. So there's lots of things that we can do. It's a little slow getting moving, but there are positive things taking place.
I do have a question from the chat, Renee, if that's okay. Allison asks, where do we rank in the U.S. with overcrowding? I think you mentioned it, but we want to get that clear.
Yeah, number 2.
Number 2. And we would be, also the next question is, what is the current plan for July 1?
Yeah, so really on July 1, what will happen is the governor will declare an overcrowding emergency, because we will be well over 150% of design capacity, and he's required by law to do that when it's at 140% or higher. And then it lays out in the state law that the parole board will then look at everybody who's past their parole eligibility date. And I'll go back a little bit. When you come in the system, like let's say I come into the system and I've committed robbery or whatever, and I came in 2016, there's a couple of important dates for me. One is the date that I become parole eligible, so that the parole board can take action and release me out into the public with supervision by parole officers. So I might have that in March 1st, 2020. And then I have another date on that says that's my total end date. That's my tentative release date, might be 2023. So I kind of have 2 dates when I come in the system. Most of us, some don't, but that's getting into the weeds. So once I hit that parole eligibility date, then I'm eligible for that hearing by the parole board, and they can grant my release. So there's a pool of people right now that are past that parole eligibility date. Like I said, it's about 850 people. And under the law, then the parole board will go in and review all those people and see if they can be released. Like I said, they've already been reviewed by the parole board. The law has some things in there to kind of say, okay, these are the people that we can move forward. If they don't meet these certain criteria, you should be paroling them, like a safety risk, things like that, programming needs, things along those lines. But for the most part, I don't see that the parole board's really going to go off and release 800 people or even 100 extra people, because all those people do have, a lot of them were paroled once, and then they did something in the community and came back. Some of them have refused to have either violence programming or substance abuse programming, things like that. So, they all had something working against them already. So on July 1st, that's what will happen. I don't know that much will actually take place then.
Janet, I believe you had a question.
Hi, I'm Janet, and I'm in District 1. Tecumseh would be in our district. So last year, I spoke to hundreds of people in that area that have previously worked at Tecumseh. And I talked to a lot of people that currently work there before they were gagged from talking to the public, or to me anyway. What I heard over and over again, especially it surprised me from the people that used to work, the turnover rate is so high. I asked them if they had better management, if they had better leadership within the system, would you go back? And they said, yes, the problem was not the prisoners. The problem was not the work. The problem was how we were treated and how the system works. And I said, but they're paying 10 grand or whatever, wouldn't you want that bonus? And they said, it is not worth it. The humiliation and the way we are treated as employees is absolutely horrendous. I heard that from people in the system, but a lot from people that used to work there. So I would like to just tell you that if that management structure, at least for Tecumseh, I can't speak for any place else, improved, or at least from what I heard, I think you would be able to get a lot more people that are already trained, that have been in the system, to come back. I also heard from some service providers, like psychologists or trainers, that they felt that it was a hostile management environment as well. And I used to be on the NEOC Equal Opportunity Commission, and some of the stories I heard were horrendous, coming from a state institution, and would be something that would be something that the Equal Opportunity Commission should look at. So I don't know what your thoughts are on that. I wanted to share that with you. And I have a list of names of people that might go back if we are ever in that crisis situation where, you know, COVID takes out all of our staff. You might be able to call some of those people back. But also, I heard of people that were eligible for parole and could not be paroled out because they did not complete the required programming. And the programming was the responsibility of the state, but they couldn't keep up with it. So we are warehousing many more prisoners that should be out if we were able to get more training in. So those are the things that I learned from door-to-door knocking in the district. So I just wanted to share that with you and see if you concur, or if there's anything we can do about those things, or if maybe I'm off, whack on those issues.
I'll touch on the last one first, on the programming needs. That's a thing that I've kind of gone around and around with the department, in that they say that they're providing programming to the people who requested it and have complied and with their behavior and things like that. So they're providing it in a timely manner. But the problem is that you have a lot of people who do have behavior issues and they don't comply. And so what do we do about those folks? I mean, we have people with substance abuse issues who don't get into substance abuse treatment because they keep getting in trouble because they use a substance. And so then they don't get the treatment. And so, yeah, that programming is definitely a problem, an impediment to moving forward. And there's lots of challenges with that. And I agree with what you said. As far as the management and the work environment, things like that, I hear a lot of concerns from staff, to be honest, and I do a lot of looking into that. One of the things that I've done as Inspector General, when I started back in 2015, was to reach out to staff. I was trying to figure out how I can reach out to them and learn from them and get educated and everything. So over the years, I've done staff surveys, and they're found in my annual reports. And I ask about the work environment and those kind of things, and like, do people believe that they're going to be there 3 years from now? What's keeping them from wanting to be there? What's kept their, or what have they seen as the result of why people have left? So I have a lot of data on that, and I've broken it down by facility and shared it with the department. And what you said is, I mean, that's not untrue, and that there's a lot of feelings from staff that they could have a better work environment and everything. And yeah, you can see a lot more about that in my annual reports. But thank you for those insights. I appreciate that.
There was just one other thing that they mentioned, and that's people that are working there now. People are being promoted that are not qualified to be promoted, and they're not managers, and they shouldn't have been promoted, but it might be because you guys were they were in a tight situation and, had to make those decisions. But I just wanted to mention that too. Thank
Okay.
you.
Thank you.
Thanks, Janet. Fred, I noticed you took your mute button off. I didn't know if you had a question.
No, I'm just listening to the information, frankly.
Okay.
It seems rather despondent, to be quite honest with you. And I think the challenge is, how do we correct some of those things that he's reporting on, frankly?
Mm-hmm.
Yeah, I always feel like I'm a very negative person when I present to people about this stuff, but there are a lot of challenges that need to be addressed and everything, and I think it's important that we're aware of those, and that's one of the reasons the legislature created this position. So, but like I said, there are other positive things going on as well too, but there definitely are some things that need to be changed and are adjusted.
Do you need additional help?
Me personally?
The office itself.
Yes. Yes, I definitely do. And I've said that in front of lots of people, and I even put it in my annual report. So I have, we were looking at doing something this legislative session actually, and that probably is going to be put on the back burner now because we do have a little bit of a budget problem. But the legislature has been receptive to that this year, and to try to help me out because they see that there are a lot of things going on, and it's difficult to do that when you're just one person. So you kind of get what you pay for too. So
Allison has another question in relation to July 1. She asked if we had enough probation officers to carry out what we needed to do.
right, that's a good question. Yeah, the people when they get released on parole, if the parole board was going to move them out, we would have to have parole officers to serve them. So if we release like 800 people, that's going to add to the caseload of those parole officers. Right now, the parole administration probably could handle about another 200 people coming out. But if we were going to go beyond that increase, they would need more staff as well. Great question.
Renee, did you have a question?
I just am, we'll see if anyone else has any questions. Otherwise, mine's sort of a, I think, a final question. Lisa.
Just saying. Okay. I've heard a lot about the fact that about the use of halfway houses and how much cheaper they are. If we even would fund that, you know, appropriate some money to that, do you see a number of inmates that would qualify for something like that? And how do you see that working?
That's a good question. One of the things that the legislature was looking at this year is there's a place out in Hastings called Bristol Station that has like 50, I think it's 50 beds for state inmates to come out to right now after they leave. But you could use a facility like that to be, it's kind of a halfway house now, but could we put people on kind of pre-parole and move them out to that kind of facility where there's a lot of structure, a lot of oversight and everything? So the legislature was looking at doing something like that. But then when people move out, you do need places for them to live. That's one of the biggest challenges when they move out, is to have appropriate and safe housing. So halfway houses or things along those lines are definitely needed. We're lucky in some parts of the state to have, like Lincoln seems to do fairly good as far as housing, but other parts of the state don't. But there's always a need for good, safe, and affordable housing when they get out.
So Doug, aside from more support for your office, are there one or two things you think that the legislature could do to really help this program? Like what would be the 1 to 2 most important steps that the legislature could take?
I think that it has to be a combination. When you're looking at the overcrowding, and the overcrowding really impacts everything. When you have an overcrowded prison and the staff are working there, they're more stressed. There's more demands on them. They have more people coming at them asking for help or even complaining or whatever. I mean, there's just, it all really comes at them, and they're trying to, it's not a safe and secure environment as it should be when it's so overcrowded, and that adds to their stress. So overcrowding impacts staffing, impacts so many other things, like I said. So, but to address overcrowding, you really need to do a couple different things. One is you have to do something more on the front end, apparently, like with sentencing changes, putting more people on probation, doing specialty courts, things like that. What we've seen, those incarceration rates, as those have gone up, what's really driven those have been lengthy sentences. The sentences have gotten longer over the years in our state, in all states, and in the federal system as well. So something has to be done as far as sentencing reform and kind of those front end measures. Then we also probably need to add some capacity and do it in a way that is not spending a ton of money, but needs to be very effective and also promotes treatment and programming. Whether it's just a standalone substance abuse treatment facility or a job training center, things like that. You could get pretty creative. And then on the back end, you know, having people released out into their home communities. Right now, if you're getting ready to finish your sentence and you want to go to a work release center, to a community corrections center, Your choices, if you're a man, are Omaha or Lincoln. That's where you're going to go. So if you're from Grand Island or Scottsbluff or Chadron or wherever else, you're not going to transition back into your home community if you're a man. If you're a woman, your only choice now is Lincoln. The Department of Corrections, when they added the 160 beds in Lincoln, they eliminated their female community corrections beds in Omaha, even though 35 to 40% of the women that come into the system are from the Omaha area, and they all will be returning there. And so what happens when you're on work release is that you get a job and you start doing that transition in your community. But right now we have, what are we at? 600 and some community beds in Lincoln and 180 in Omaha, and none in the rest of the state. So I think doing something, probably won't happen anytime in the near future because of the financial situation that we're going to be in, but doing something with community beds throughout the state, whether they're small units or using work release centers in jails, like Hall County in Grand Island has a work release unit of about 30 beds that the last time I was out there was pretty much empty, and we could contract with them. If we could do things like that, you know, it's a combination of things. It's just not one thing, but it's a combination of things to do. And it's pretty overwhelming.
Well, thank you, Doug. We really appreciate you spending this time with us today. And thanks so much to all the candidates for being here. And we hope that you'll join us again tomorrow, where you'll hear from the Open Sky team. Doug, I empathize with you feeling like you're always kind of a downer in your presentations. When we talk about the budget, I feel the same way. So thank you all, and we look forward to seeing you all again tomorrow. And thank you, Doug, for sharing your expertise with us today.
All right, thank you.
Bye, everyone.
Bye.